A lot of what people write off as just getting older is actually something else. Low vitamin B12 is one of the biggest culprits. It can look like memory loss. It can look like being tired and weak all the time. It can look like your hands and feet going numb. In some people, it even looks like the early stages of dementia. And families come in frightened they're losing someone. And this is the part I really want you to hear. A lot of the time, once we find the low B12 and treat it, that person comes back. The fog lifts. The strength returns. Your body needs B12 for your nerves and your blood. As you get older, you absorb less of it from your food, and some common medications make that worse. So this is a problem that sneaks up on older people especially, and it gets brushed off as normal aging, when it's actually something you can fix. I want to go through 9 warning signs of low B12 today. There's one sign here, number 8, that worries me more than the rest. I'll point it out when we're there. Let's take them one at a time, starting now. Sign 1. A deep, drained kind of tired. The first sign is exhaustion. Not ordinary tiredness. A deep, drained, no fuel kind of weak, where your arms and legs feel heavy and small tasks leave you spent. B12 is one of the things your body needs to make red blood cells. Those are the cells that carry oxygen to every part of you. When your B12 is low, you make fewer of them, and the ones you do make come out too big and don't work properly. So less oxygen gets around your body, and you feel drained and weak. Being tired can come from plenty of things, so this one on its own doesn't prove much. But it's where low B12 usually begins, so keep it in mind as we go through the rest. Sign 2. Your skin looks pale or slightly yellow. The second sign you can see. Your skin looks pale, or it takes on a slightly yellow tint. Some people notice it first in their face, or in the whites of their eyes, which can look a little yellow. This ties back to those red blood cells. When B12 is low, you make fewer of them, and that makes your skin look pale. On top of that, the faulty red cells break down faster than they should, and as they break down, they release a yellowish substance that can give your skin and the whites of your eyes a mild yellow color. Look in the mirror in good light. If you're paler than usual or a bit yellow, that's worth checking. Sign 3. A sore, smooth, red tongue. Number 3 shows up in your mouth. Your tongue can get sore, red, and a little swollen, and it may look smooth, like the tiny bumps on it have worn away. Some people get mouth ulcers, or a burning feeling on the tongue, or they notice their food doesn't taste the way it used to. The cells lining your mouth and tongue renew themselves very quickly, and they need B12 to do it. When B12 runs low, those fast renewing cells are some of the first to suffer. So your tongue and mouth are often one of the earliest places the deficiency shows up. Stick your tongue out in the mirror. If it looks unusually smooth and red, and it's been sore, that's a real clue. And it's one almost nobody connects to a vitamin. Sign 4. Brain fog and forgetfulness. The fourth sign is in your thinking. A fog settles in. You forget things you normally wouldn't. You lose your train of thought partway through a sentence. You struggle to find words or to concentrate the way you used to. Your brain needs B12 to work properly, and when it's low, your thinking slows and your memory slips. This is the one that scares families, because in an older person, it can look exactly like the beginning of dementia. And that matters, because a good number of those cases are not dementia at all. They're low B12, and they get better once it's treated. That's why it's worth ruling out first, before anyone jumps to conclusions. Sign 5. Changes in your mood. Number 5 is a change in your mood. You feel down or flat or anxious. Little things make you irritable. You just don't feel like yourself, and you can't point to a reason why. B12 helps your body make some of the chemicals that keep your mood steady. When it's low, those can fall out of balance, and it can leave you feeling depressed or on edge. People sometimes get treated for depression or anxiety when the real problem underneath is a vitamin their body is short on. If your mood has shifted and nothing in your life explains it, low B12 is one of the simple things worth ruling out. Sign 6. Dizziness and shortness of breath. The sixth sign is feeling dizzy or short of breath, sometimes with a heart that pounds or races. You go up a flight of stairs and you're winded and lightheaded. You stand up too fast and the room tilts for a second. You feel your heart working hard when you're barely doing anything. This goes back to the low oxygen again. With fewer working red blood cells, less oxygen reaches your body, so you get out of breath easily and feel dizzy. Your heart tries to make up the difference by beating faster and harder to move what oxygen you do have around. That pounding you feel is your heart working overtime. Sign 7. Pins and needles in your hands and feet. Number 7 is where low B12 starts to reach your nerves. You get pins and needles, or numbness, in your hands and feet. That tingling, prickling feeling, often in both hands or both feet at the same time. Your nerves are wrapped in a protective coating, a bit like the insulation around an electrical wire. B12 is needed to build and maintain that coating. When B12 is low, the coating starts to break down. The nerve underneath gets exposed and it misfires, sending out those tingling and numb signals. This is your body warning you that the deficiency has reached your nervous system. The good news is, it's still very fixable at this stage, which is exactly why you don't want to let it slide. Sign 8. Trouble with your balance. Number 8. The one I said I'd warn you about. It's trouble with your balance. You feel unsteady on your feet. You catch yourself reaching for the wall or a piece of furniture. Walking in the dark or on uneven ground suddenly feels a lot harder because you can't quite feel where your feet are landing. This happens when the deficiency reaches deeper into your nervous system, into the nerves that tell your brain where your body is in space. When those nerves are damaged, your balance goes, even when your legs are still perfectly strong. I worry about this one for 2 reasons. First, in an older person, being unsteady means falls, and one bad fall can change everything. Second, it's a sign the nerve damage is getting serious, which brings me to the last sign. Sign 9, numbness and weakness that keeps getting worse. The last sign is numbness and weakness that spreads and gets worse over time. What may have started as a little tingling in your toes creeps up into your feet and your legs. Your hands get clumsy with small tasks. Your legs feel weak. Some people find it harder and harder to walk. This is the deficiency doing real, deepening damage to your nerves and even to your spinal cord. And this is the part that makes low B12 different from most things I talk about on this channel. If it goes on long enough, this nerve damage can become permanent. Even after you fix the B12, some of it may not come all the way back. That's the whole reason I made this video. Almost everything about low B12 is easy to fix when you catch it. A blood test finds it, and the treatment is cheap, usually pills or a simple injection. But the longer it goes untreated, the more you risk damage that doesn't undo itself. So if any of these signs sound like you, please don't leave it for months. Get it looked at. If you take one thing from this video, make it this. Caught early, low B12 is one of the easiest problems there is to put right. Ask your doctor for a simple blood test that measures your B12 level. If it comes back low, they'll help you find out why and then treat it, usually with B12 tablets or a short course of injections. A lot of people say they feel like a different person within a few weeks. Some people are far more likely to run low, so this is worth knowing. If you're over 60, if you take a medication for acid reflux, if you take metformin for your blood sugar, or if you eat little or no meat, eggs, or dairy, your risk is higher. All of those make it harder to get enough B12 or to absorb it. Hit subscribe if you want me to keep sending these your way. Before you go, one connected video. One of the most common diabetes medications is a big reason people run low on B12 in the first place. So high blood sugar and low B12 often travel together. I made a video on the warning signs your blood sugar is too high, and it's on the screen now. If today's signs sounded familiar, that's a good one to watch next. Take good care of yourself, and I'll see you soon.
Disclaimer. The information presented in this video is intended for educational purposes only and is based on published, peer-reviewed scientific research. It does not constitute medical advice and should not be interpreted as a diagnosis, treatment recommendation, or substitute for professional medical consultation. Individual health circumstances vary significantly, and what is appropriate for one person may not be appropriate for another. If you are currently undergoing cancer treatment, have been diagnosed with a serious medical condition, or are taking prescription medications, please speak with your treating physician or oncologist before making any changes to your diet or health protocol. The studies referenced in this video are real and publicly available, and I encourage you to read them. But research findings, even strong ones, are one part of a larger clinical picture. Your doctor knows your history. Work with them.